My name is Dr. David Russ. I'm a chiropractor in Portland, Oregon. And if you're watching this video, you probably are in pain. You probably have a herniated disc. You've been told that recently, or maybe not so recently, and you're wondering what is happening because the pain can be extreme and intense and very, very scary. And I know that information can be really useful at times like that. So I'm here to share some information with you. This is not a fancy video. I don't have background music. I'm just going to share information. If you want to talk to me, because I will not give medical advice in the comments, that would be entirely wrong. You can see my website here. I'll also put my website in the comments or the description of the video. You can get in touch with me. We can schedule a Zoom call, a phone call. We can do a consultation and see if I can help you out. So herniated discs, what they are, how they happen, and why they hurt so much. So in case you don't already know, that's what your spine looks like. And there's the side view. And if we look at one particular vertebra, we're just going to look at a lower back vertebra as an example and look at the disc here. We have the structure of the disc, the outer rings of tissue. It's concentric circles of very dense, very strong fibrous tissue, and that's called the annulus fibrosus, mostly just called annulus. And in the middle, we have a gelatinous substance called nucleus pulposus, mostly just called nucleus. And if we look at it from the side, we see vertebra, and there's a disc, and a vertebra, and there's the back part of the bone. This is the part you feel when you feel your back. The bumpy part is here. And here we are again. You see the outer part is called annulus fibrosus, and the inner part is called nucleus pulposus. And this is a picture of a healthy disc. And what it looks like when it's unhealthy is a little more like this. So here you can see the annulus, and it started to fray here and come apart. So this is weakened. And this happens with repetitive injury most of the time. Sometimes there can be one severe trauma like a car accident or a fall. Sometimes people rupture discs falling from horses or ladders. But most of the time, it's wear and tear over time. You get these tears in the annulus, and they start to coalesce and form bigger tears. And now it looks like we had like 1, 2, 3, 4, maybe 5 tears. And that nucleus is migrating out. And now the annulus is so torn, it's only got one layer left. It's really weak. So the nucleus has pushed the annulus out, and it's pushing on the nerve as it exits the spine. And that is really, really painful. There's a bunch of things that I want you to understand about this. Over here on the left side is a healthy one. So there's still some tearing here, but the nucleus hasn't migrated out. There's no bulge or protrusion. There's plenty of room for the nerve, but that is not a big space. That nerve normally has this enlargement in it. It's called the dorsal root ganglion. That doesn't matter. Just know that the nerve is a little bigger. The space is kind of small. There is not a lot of room. It doesn't take much protrusion of the disc in order to actually physically impinge on this nerve. Let's look at the disc itself. Here is a picture of the disc. This is anatomically correct. Here's that dorsal root ganglion I was telling you about. And here's all the branches that come off the spinal nerve as it exits that little tiny space. This branch right here comes and it innervates the disc itself, okay? The other side is identical, okay? So these nerve endings surround the whole disc all the way around, and generally they're only on the outer third or so, but these are pain sensitive. So if we look back here, these smaller tears that are on the inner part of the disc, you never would have felt those because there's no nerves there. Here, once we start to get tears on the outside of the disc, we start to get some pain. And what does disc pain feel like? Disc pain is deep, achy. It feels like pressure. You feel stiff and stuck, like a lot of people, like they try to adjust their own back. They're trying to get some movement in there because it just feels so stuck. And because it's so deep, the brain has a hard time localizing or pinpointing where that pain is. So a lot of times it's experienced as just kind of like a general, what we call a diffuse ache. And I'm gonna highlight this here for a second. It has a strong emotional component. And there is no doubt in my mind, I have seen this almost 100% of patients who have disc problems. There is a lot of emotion that goes along with the pain. They're scared. A lot of times there's a despair and a feeling like I'm never going to get better, like something is wrong in a way that it has never been wrong in my body before. And the reason is this ganglion right here, this nerve plexus that mediates the disc pain, is directly connected to the part of your nervous system that is the fight or flight. This is called the sympathetic chain ganglion, and the sympathetic part of your nervous system is the part that is fight or flight. So as you're getting pain from here, from annular tears or disc bulges, it is lighting up that part of your nervous system that mediates your fight or flight. Okay? So that's why, I mean, I know it hurts and you're probably pretty scared about it. And that's why. So here's a side view of that disc bulge. So here are the vertebrae, you know, the force of the vertebrae coming down and up are pushing the disc backward. And as you can see, if we look at these nerve roots, like if we took this nerve root and we followed it, it's going to go down the leg. And so if you squeeze the nerve or irritate the nerve here, you're going to feel pain along the whole course of that nerve. In normal times, there's messages coming in and out of this nerve. And so the brain up here is communicating with the foot down here through this cable of a nerve. Well, if you pinch the nerve here, you're pinching off the flow of information. The brain cannot identify where this is happening. It's going to interpret it as coming from potentially anywhere along the course of the nerve. And so that is why when you have a disc herniation here, you feel the pain in the leg. When you have a disc herniation here, you feel the pain in the arm. And one thing interesting about this, this diagram is like, look how big this hole is. You would think there's plenty of room in this hole for this nerve, but I actually really like this drawing better. That there is no space in that hole. That hole is cram-packed. So all this like bubbly yellow stuff, that's fat. And the fat is there to protect and provide protection for the nerve. And the nerves would be here, and that little blue thing would be a vein, and that little red thing would be a little artery. And don't be fooled. This is a very, very, very tight space. When you are feeling nerve pain, like I said, you're going to feel it along the course of the affected nerve. It usually feels like hot, sharp, stabbing, shooting pain down the leg or arm. A lot of times it's described as stabbing. And in addition to the pain, there's changes in sensation like tingling, numbness. Some people describe a sensation of crawling on their skin, or it can feel cold or cramping. So now we have two layers of pain. Okay, we have the disc pain, which we described before. That's that low back or neck, deep aching pressure and stuckness that freaks you out. And then on top of that, you have the nerve pain, which is hot, sharp, and shooting. It's really no fun. It can be just agony. Now, many people with herniated discs on the MRI have no pain, even though you can see the disc pressing on the nerve. So why don't they have pain? It's because the nerve pressure is not enough to cause pain, unless it's severe. But a little bit of nerve pressure is not going to cause you the problem. What causes you the problem is the swelling and inflammation. So in this tight space, you start to add some inflammatory fluid and the pressure builds up tremendously. In addition to that physical pressure, the inflammatory chemicals are extremely irritating to this nerve. This red, hot, aggravated nerve, it's not just direct pressure, physical pressure that's causing that, it's inflammation that's causing it as well. So that is why it is crucial to address the inflammation when you are doing disc healing. We'll talk about the nitty-gritty of that in another video, which will be on my channel, and you'll find it as soon as I put it up. Another interesting thing about this, I'm going to get into some medical stuff here, is that the nucleus, during your embryological development, as you're developing in utero, that nucleus is contained within the annulus before your immune system forms. And so that immune system has never encountered the nuclear material. It doesn't recognize it as you. When that nuclear material leaks out in a disc extrusion or a sequestration, which is a more severe form of that, the immune system attacks it as though it were a foreign invader. It treats it like an infection, and that is why the inflammation can be so severe. So our two layers of pain so far are nerve pain and disc pain. Now we're going to add another layer of pain, unfortunately, and that is muscle pain. So here's the muscles, just the outer two layers of the muscles of the back and neck. the outer layer on the left, the second from outer layer on the right. If we go in a little deeper, we have other layers, and then in the front, our spine is just cram-packed. Everything about the spine, it's totally enveloped in muscle. And a fun fact about this, especially if you look at the psoas muscle here and the quadratus lumborum muscle here, when they are tight and short, as they often will be when you are in pain, you see how they're attached to the vertebrae and attached to the discs? They clamp down and actually increase the pressure. They make that hole even smaller. They make the pressure on the disc even greater. So getting these muscles to relax is a huge part of helping you get out of pain. I have a diagram here of just one muscle, the quadratus lumborum superficial division, and how issues in this muscle can refer pain into the hip, leg, and lower back. So now we have 3 layers of pain. We talked about the nerve pain, that hot, sharp, scary shooting pain down your leg. We have the disc pain, which is that deep, achy pressure and stuckness that is really scary in your lower back. And now we have muscle pain. And everyone knows muscle pain, anytime you've exerted yourself too much, it's sore, it's achy. If it's really bad, it'll feel like it's spasming and cramping. I was just talking about how those tight, short muscles in the region of the disc will clamp down on the vertebra and put more pressure on the disc, increasing your disc and nerve pain. Well, guess what? There are some muscles that nerves go right through them. And when those muscles are tight and in spasm, they will actually just directly clamp down on the nerve. And over here in the neck, we have our scalene muscles, the anterior scalene here and the middle scalene here, and all the nerve roots going from the neck to the arm go right between those muscles. So here's the disc and the C5 nerve root. So the C4-5 disc herniation can irritate and aggravate that C5 nerve root, causing pain, causing these scalene muscles to clamp down, which would just increase the pressure on the nerve and also potentially clamp right down on the nerve itself. Here in the back of the hip, this is the sciatic nerve. And if you're having a lumbar disc, this is probably where you're having a lot of pain. Well, guess what? That nerve goes right through the piriformis and gemellus muscles, and tightness or spasm of these muscles will clamp down on the nerve as well. So this is just a brief description of the layers of pain that you may be experiencing. I hope this helps you make sense of what you're experiencing. If you have general questions, please put them in the comments. I'm open to feedback about this in any of my videos. Please keep it kind. And again, if you want to talk to me, go to my website, use my contact form. We can set up a Zoom call or a phone call, and I maybe can help you with some specific advice. Thanks for watching.